And I'd like to introduce she's on the phone with me, Dr. Garima Singh. Dr. Singh, good morning. How are you today?
Good morning. I'm good. How are you?
I'm doing well also. So we just did hear something about bullying, and it is a concern that I think many of us have about our children and bullying, no matter when it occurs and where it occurs. This is Mental Health Month, Mental Health Awareness Month. Where does bullying factor into your practice and your work that you do through your services?
It's day to day. We see it a lot in our clinical practice, both in outpatient and inpatient. Unfortunately, some of our kids get admitted because of bullying and the after effects of that. So yeah, it's very prevalent, and unfortunately, it's happening in everywhere.
How young are some of the youngest that you see who you would say, gosh, they have had to deal with bullying?
So if you read the literature, or if we go by what studies say, it says that the bullying usually starts around middle school, but nowadays we are even seeing it in elementary school, and I have a few rare where it's like kind of prevalent in the preschool system as well.
At what point does it become of serious concern? I think we've all probably experienced sometimes where people have treated us unkindly. Kids do that to each other. What are the symptoms that a parent or someone who is a doctor like you are of psychiatry that you would start to take notice and become overly concerned?
So anytime, and I tell this all the time to all the teachers, counselor, parents, anytime they see a change in their child's academic performance, personal life, social life, there is majority of time, and I would say 99 out of 100% of the time, there is a reason behind it. So some of the signs which we often see and the parents notice is when kids come home with bruises, cuts, unexplained injuries, they are refusing to go to school, their academic performance is dropping, they are losing or they are coming with damaged clothing, books, possessions, often complaints about not feeling well, multiple reasons, not going to school in the morning, my stomach hurts, my head hurts, or other kind of physical symptoms for skipping classes. In some of the middle school and high schoolers, I often complain about they want to skip certain classes. And if we dig more into it, the reason for that is they are getting bullied there or something is happening there. If we don't stop it when something like this is happening, then we often lead into symptoms of depression, sadness, low self-esteem, isolating themselves. Parents often complain about mood swings or like being more irritable and angry, wanting to run away from home. I also have had kids who talked about taking weapons to school is because they want to deal with the bully, or in some of the rare circumstances, they're talking about suicide or violence against others. So these are some of the common signs which we hear about and kind of where somebody needs to step in and get the help needed.
I don't believe this would be something that would be easy for a young person to talk about. How do you get them to open up, or what would be an advice you would give for those who would maybe need to say what is going on and then maybe on their way to seeking professional help or seeing someone like you? But how do you get that first conversation going?
So as I often said, the first step is either a school counselor or parents or teacher, any bystander, anybody, even a friend, a peer who sees that their friend is struggling or, they are witnessing a bullying happening at school or school bus or somewhere, or we see any difference in our kids' performance or in day-to-day activity, it's always a good reason to talk about what's happening. And you are right, it depends on what age we are talking about. My 5 and 6-year-old is not going to say what's happening, so it's often a physical symptom. I don't want to go to school because my tummy is hurting. So what's happening? Digging more into it, what's going on, or how they are reacting to peers, to siblings. What we see, what we act. So if the child is getting bullied at school, they often try to bully or be mean to kids in the neighborhood or to siblings. So just finding the root cause. The first step is to, as a parent, to know the details about what's happening, getting into the details, how, when, where it's happening. Then maybe talking to the school would be the next step, and then getting involved with a counselor. and the school administration. If it's to the point where it's affecting the kids' mental health, that's where a mental health professional needs to be referred to or seek help for.
Somebody who would be listening to us right now, maybe a parent, maybe somebody involved or understands or concerned about a young person would say, well, the school year is almost over, so we can take a deep breath and not worry about it so much. What would you say to those who would say, well, bullying is going to be much more of an issue during the school year? And some of the answers that you've just given us have referred to the school or classroom setting. What about summertime and bullying?
So a majority of our kids go to summer school or they go to summer camps or things like that. I never say that the school is going to over. I always feel it's a very important thing, and if our child is complaining about it, it needs to be taken action right now. So every time I tell my parent, if your child is complaining about it, first of all, thank your child for telling him or her, and then validate the feeling, validate what's going on, and something needs to be done right then and there. That won't be a right perspective to say that the school is over, because it's gonna move on and will lead to further consequences, which we don't want our kids to be dealing with.
I like what you just said. You said thank the child for telling you. I think that's kind of an interesting thing, to appreciate the fact that they trusted you enough to tell you this, whether you're a parent or someone else, maybe a counselor or maybe a teacher. I think to be able to reinforce that the child did the right thing by sharing this information, I think is crucial. Anything else you want to leave us with before I let you go?
There are multiple resources which parents or the school can find. It's all available online. Let me see. That would be something. And above all, the most important thing is prevention, and education is the most important thing which we can intervene in it. So educating our kids, our teachers, our counselors, our parents is the first step in prevention of bullying.
And education would mean saying what is appropriate, what is inappropriate, and then saying share that information if it happens to you.
Sure, yes. And then if anybody is witnessing it, they need to step in. We don't want to be a bystander just feeling like, oh, it's not me. Somebody needs to step in. So being an informative bystander and just getting involved and getting the help.
Well, it's an important thing to keep in mind. Bullying, it will be something that you'll need to be aware of when you think also of Mental Health Awareness Month, because bullying can lead to some mental health problems, as Dr. Singh has just said. Dr. Garima Singh from the University of Missouri Healthcare also works at the Thompson Center, a child and adolescent psychiatrist. Thank you very much for your time today.
Thank you so much for having me. Thank you.